Hello, my name is Jonathan. We're going over chapter 16 or 15, I believe, on week 11 for therapeutic modalities. Should be going over all four SLOs are being topic. So starting off with number one, identify the most common indications for therapeutic modality application. Just to go over the definition for like their therapeutic modality, it's pretty much like the application and use of instruments, tools, or whatever you can define that word as, to treat or they're used as curable tools to treat pain relief and etc. For the indicators for the application, which is the question that's asked, is pretty much like pain relief, restore muscle contraction, joint stabilization, swelling management, treatment of adhesions, pretty much bandage up a certain spot or even tape up or even suture it, depending on the situation, of course. And manual therapy, just to get more into manual therapy, it's the third SLL that's reading identify two of the many forms of manual therapy. You can think about it as general massaging of the athlete and or client, and there's also joint mobilization, which can also be interpreted as passive range of motion. So the idea behind that, let's say you just got a surgery, you're doing a stretch, but you're unable to complete the stretch due to lack of force, lack of muscle contraction, and muscle memory due to you just came out of surgery. And the client, or not partner, the physical therapist or athletic trainer will help you go through a range of motion without you actually doing the forces to produce that movement, of course. That's pretty much they're doing it for you in a sense. So I answered number 1 and 3. So I'm going over number 2, which is describe the common forms of heat and cold, the main treatment goal, and general precautions and contraindications for each. So for common forms of heat and cold, so heat packs, heating lamps, cold packs, whatever you're going to use, whether it's like direct a bag of ice and just put ice cubes in it, and you put like one layer of cloth to prevent cold adhesions. They're pretty much used for the same thing, pain relievement, depending on the situation, of course. So they're going with cramps to do certain application, heat for main causes. They do both help reduce swelling. So for the article I did use regarding cold and heat after exercise, they do both play a factor in reducing swelling, pain management, and even range of motion. Let's say you went after an injury and you got a certain well, not injury itself, but inserting body part of your body that's being swelled up or even bruised up, and there's like limited mobility, limited range of motion. Heating is a little bit subpar to colding, not a big difference, but there is a slight difference between those two. Colding has a better effect to the body after a 2-day period in regards to actually heating. Not to say that heating is not a good thing, just for reference from the article I did use from the Journal of Strength and Conditioning Research. Cold application is way better. Things to avoid and to be keep in mind of for the precautions and contradictions for each. So for cold indicators, the things I did write down were cold urticaria, which pretty much rashing of the skin. Think the body gets cold, you use cold application, within minutes the body turns red and becomes itchy, stinging, and you get little pricking sensations. There's also Raynaud's phenomenon, which is more traumatic in that case. It's the same thing, get turned red, but it's more of a syndrome, that disorder that causes blood flow restriction in where the area of cold application was applied. There's hemoglobinuria, which is pardon me, that one, and cryoglobulinemia, which is pretty much you have antibodies that are really sensitive to cold temperatures, which then provide rupture of the cell. So yeah. And then number 4, describe how EMG biofeedback, for heat factors are to be warned and be cautious of. Too much heat application in the skin may cause adhesions, so think about it. Your skin's sensitive, you're not applying the heat directly to the body, especially for over periods of time. They're going to burn and eventually cause more pain and even infections. So describe how EMG biofeedback, number 4, can be applied in rehabilitation. So this is asking for feedback itself. So the feedback of the electromyograph is pretty much what the muscle forces being developed in that certain area. So pretty much muscle contraction and recruitment of the muscle fibers and force development. The use behind that, wasn't just feedback, but the use of the feedback and then be applied directly to rehabilitative forces and exercise and regimes. So pretty much this feedback itself just gives you understanding if whether or not the treatment itself is working, or prior treatment to understand what is lacking or the level of force development in the individual. Thank you.